Hi, I'm Dr. Davidson, and I'm going to take a few minutes of your time just to talk to you as a maternal child health nurse, as a nursing educator of maternal child health, as well as a nursing education consultant about why I switched from the traditional maternal child health textbook to the case-based approach textbook by O'Meara and Tagher and Knapp. I've always been an advocate of case-based learning. When I was teaching from the traditional textbook, I created my own stories, and I felt like it was so important for students to be able to see how pre-pregnancy, pregnancy, and the labor and delivery experience all contributed to the postpartum and newborn outcome. Although the resources were really excellent with interactive case studies and virtual simulations, they were a snapshot in time, and they never really related all the process from pre-pregnancy to newborn, so that the students could see that they are all interactive and that one affects the other. When I started working as an NEC for Wolters Kluwer, I was introduced more to the O'Meara and the Tagher and Knapp case-based approach, and I was working on some projects with them when I thoroughly could read the clinical scenarios in their books. And then I realized how these stories were so much more involved and so thorough compared to the stories that I created. They had the patient perspective, they had the partner perspective, they had the nursing perspective, along with a lot of extra things like laboratory studies, and it was just so much more thorough than I could create. And I was convinced I needed to make the switch from the traditional textbook to the case-based approach textbook. The content chapters and the clinical scenarios in these case-based books really helped me teach clinical judgment development to my students. And we know that that's really, really important, especially with the change in the NCLEX RN exam to the clinical judgment measurement model. But it's also more important that we develop practice-ready nurses that can provide safe patient care when they graduate. The content in the second edition of the O'Meara and the Tagher and Knapp case-based approach books have clinical judgment boxes in every single content chapter relating the stories to the chapter. So it's going to make it even easier to adapt and switch to the case-based approach of teaching. I would also like to say that my students loved the clinical scenarios. There is a sense of reality, a sense of meaningful learning with each of these stories, and the students actually became attached to their clients and really loved following their stories throughout the semester. I would like to close by saying that case-based textbooks have all the wonderful qualities of the traditional textbooks. They have the interactive case studies, they have the virtual simulations, they have the prep you, but they have so much more with the stories. So thank you for taking the time to listen to my story about why I made the change to the case-based approach textbook.